Hello, you're listening to Hold On a Minute, a podcast by UNFPA Asia and the Pacific. This podcast series presents inspiring and powerful stories on the sexual and reproductive health and rights of women across the Asia-Pacific region. I am Pupe Chawarat-Yung-Tiranon, your host. On this episode of Hold On a Minute by UNFPA Asia-Pacific entitled Aging with Dignity, we take a look at how crucial investment at every stage of a woman's life is to her society and the region. The Asia-Pacific region is the fastest aging region in the world. By 2050, 1 in 4 people will be well above the age of 60 years old. Countries within the region are still not fully equipped to face the challenge of increased health and social care spending as the working-age population dwindle in size. The decline of the fertility rate and people living longer have contributed to larger percentages of older persons. With Asia-Pacic's population of 4.7 billion people representing almost 60% of the world's population, the way the region handles the aging society will not only affect the region, but the entire world. When women have the opportunity to lead healthy, meaningful, and independent older years, they can actively contribute to the socioeconomic development of the countries they live in. In 2021, the UNFPA Asia-Pacific Regional Office, with partners, launched a regional advocacy campaign titled For Every Age, Taking a Life Cycle Approach Towards Population Aging. With gender equality at its core, the life cycle approach supports investing in every stage of a woman's life, from her childhood, adolescence, reproductive age, into older years, so that she can age with good health, dignity, skills, and the decision-making power to be able to contribute to society at her fullest potential. Hold On a Minute, a podcast series by UNFPA Asia Pacific. To learn more about the life cycle approach and how important it is to invest in every stage of a woman's life, our podcast today welcomes 2 individuals driving this initiative. Dr. Rintaro Mori is a technical advisor working on the population aging and low fertility in the Asia-Pacific region. As a medical doctor, he has in-depth experience in the area of health and social care for women and children, both in high-income and middle-income countries. Professor Dato Dr. Tengku Aizan Hamid is the founding director of the Malaysian Research Institute on Aging, My Aging. She has been instrumental in the development of gerontological research, policy, and education in Malaysia, and sits in several national advisory and consultative committees on aging in Malaysia. Dr. Rintaro and Dr. Aizan, it's such a pleasure to talk with you on such an important topic, and that is, the aging society. Asia and the Pacific region is quite vast, and it's very dynamic. Dr. Rintaro, can you explain to us a bit about the key features of population dynamics in the region?
Yeah, thank you very much, Kumpupe. Yes, if I am asked to sort of describe the population trend in Asia Pacific in one word, it's a diversity. There are many countries in Asia Pacific where, for example, a country like Afghanistan, Pakistan, there are still, the very young populations and growing still rapidly. Where the other countries like the Malaysia, Thailand, Japan, China, it's declining and the population is aging. So we have a very diverse, the populations in our region. But at the same time, as overall, the majority of the countries in Asia in the Pacific are actually showing the population decline or actually slowness of the population growth, actually. That's the overall trend.
Population aging, on one hand, is a representation of progress because people having better autonomy of their bodies, empowered to have their own choices and have access to family planning services, and also better health overall. But on the other hand, there are challenges for an aging society. Dr. Aizan, can you tell us what are the main challenges and what are the main concerns right now for policymakers about aging societies?
If you look at the challenges of population population aging, there's multifaceted in terms of the challenges, and also it is quite difficult, or it's quite complex for the government to address the population aging issues, and as it requires coordinated effort from various government departments and sectors, and policymakers must balance the immediate needs of older person with long-term sustainability and equity consideration. So therefore, the policymakers needs to adapt to the evolving demographics of population aging. But let me say in two perspectives, because we need to look at the problems of old age at the individual level, which is poor health, loneliness, social isolation, impoverishment, and so on. And we also need to look at the problems of aging society. So we have two different perspectives. When you talk about the at the individual level in terms of policymakers, you have to look at how to address the risk of poverty in old age, and also to look at how we want to to reduce the inequality in health of these people. So and because all these issues in terms of old age problems is dependent on the trajectories of life and the social capitals of the families, and where they live in the areas of the in the country. So in terms of accessibility to health services and things like that, and also to look at the social capital that is surrounding the older person themselves. So we need to look at the preventive aspect of health promotion of health, so that the person that is growing from the life course perspective have the access to prevent ailments in later lives. So that is the perspective from the individual old age problem. In terms of societal problem, as Dr. Rentaro mentioned, the population dynamics is changing, and also the issues of economic dynamism, shrinking of working population, increasing old age dependency, and increasing the generational burden, rising costs of welfare and aged care, increasing healthcare costs, and new demands which we might not even anticipate in the future in terms of that, with the flow of the population dynamics. Therefore, we need to look at how to encourage labor force participation among women and older person, as well as encouraging longer employment, especially among skilled workers and professionals, and also to reduce unemployment among younger people, because all these issues with the unemployment at the younger age will affect them when they grow old. So those are some of the issues or the policies that needs to be addressed. So, and in terms of poverty and in terms of financing old age, we need to look at building self-funding component of pensions through encouraging individuals to save for their old age, because we know the pension commitment is very high and is maybe not sustainable. And we also need to look at to include incentive for co-funding for old age pension and services, so that the system can be sustainable. Another aspect of the care of the older person, we need to look at the containment of welfare and old age care costs through expanding of partnership between families, volunteers, private sector providers, philanthropic organizations, and government bodies in the provision and through continuous rationalization of old age care, because we cannot depend on one system. And in our part of the world, the former institution is very costly, and we have not developed actually a funding mechanism to look at the old age care and the increasing cost of institutionalization. Addressing aging needs long-term perspective, and presently many initiatives are short-term. So that means we need really to look at the political will of looking at how we should handle this issue, and also looking at the collaboration part of the individual, the community, the civil society, the private sectors, and the government together, trying to solve the major issue of old age problem in the Asia Pacific region. Thank you.
It's such an eye-opener, I think, for people, perhaps maybe like me, who have learned that aging is an issue in our society. If you talk about the region itself, and in terms of the various solutions that are possible, and the challenges that you've just mentioned that are faced for each country. But to get to know more about the situation and for our listeners to really understand what an impact it is in terms of this topic on our lives, we have a special story about a character or person that is named So let's listen to the story.
My name is I am 70 years old. I am a mother of 2 and grandmother of 1. My husband passed away 2 years ago, and it has been tough since losing my life partner of 40 years. But I get fulfillment and a sense of purpose from volunteering the community center in my town. There I teach migrants how to read and write in the local language. I use my experience as a school teacher, which I practiced for 35 years before retiring at the age of 60. I come from a humble background. My mother could not go to school. That limited her opportunities significantly. But she was determined that her daughters receive a good education. She and my father worked hard in the field and earned enough to support my and my sibling education. I studied hard and became a science teacher at the age of 25. That's also around the time I met my future husband. When we first got married, we were not ready to have children right away, so I went to see the midwife in the nearby health clinic to receive information and services for family planning. We had our first daughter 5 years into our marriage, when both my husband and I felt ready to start a family. My in-laws expected me to resign from my job to dedicate myself to raising our child, but thankfully, my husband supported my wish to continue working, and together we raised our 2 beautiful daughters. Looking back, I am grateful for the support I received and the choices I made. I am happy to see both my daughters independent with established careers. I am thankful for the pension I received from having worked as a teacher and the financial independence that brings. I thoroughly enjoy volunteering, sharing my knowledge and skills. I believe we all have something to contribute at every stage of our lives, including in our older years. I hope to stay active and healthy, to keep doing what I love, and I enjoy time with my family and my friends.
Okay, so Dr. Rintaro, we've just heard a very inspiring story. Hopefully, when I am 70 years old, I can be as active as this person. But what would you say were the factors in Om's environment which enabled her to, age with such dignity and hope?
Yeah, thank you very much. I think it shows everyone that there is a bright side of the population aging or aging. It is really fascinating to sort of listen to her story, a story of the lady on the bright side. And I think that speaks to what Dr. Item mentioned, as well as I think that speak to actually what I actually mentioned in the beginning, why the Asia Pacific is enjoying the population aging. And I think we actually observing the slowness of the population growth. And that actually came from, lots of actually developments, lots of good things it's been implemented. For example, listen to her story, they're working very thoroughly hard. Parents actually invested a lot on education, right? Education and herself. And also, I think the lots of actually sort of the reproductive choices came in. So she had a choice to determine when and how to have a child. And I think she was actually with a very good husband, understanding very good issues, which were not the case in the past. So this actually good environment when she had in the early stage of their life, that's all lead to the brightness of the actually later stage of her life, which is actually very important key message actually I got from her story.
When we talk about solutions, there is the concept of life cycle approach. Dr. Eisen, can you explain this concept a little bit in terms of how it is put in practice, and what does this mean in terms of national policies, and what can governments do with it?
If you look at aging, we don't suddenly become age, right? So we go through the life course processes, and of course, because of that, there are important issues that needs to be addressed in the different stage of development. So if you look at life cycle approach in terms of national policy, it is a framework that recognizes the different stages of an individual's life and tailors government policies and programs to address specific needs and challenges people face at each stage. Each one of us goes through various phases from birth to old age, and each one of us goes through these trajectories differently, depending on our family capital and resources, location of residence, and so forth. So life cycle approach recognizes that individuals' needs evolve over time, and policies should adapt accordingly to support their well-being and maximize their potential. It requires a holistic and integrated approach to policy making that considers the entire life course of individuals and aims to create a more equitable and inclusive society. So if we look at the life cycle stages, I would like to share some of the policy perspective that we may consider. For example, the first one would be the prenatal and early childhood stage of life. The focus at this stage probably would be on policies on maternal and child health and the investment in prenatal and maternal health care to ensure the healthy pregnancies and safe childbirth, and also to have access to prenatal care, vaccination programs, and neonatal care. So the important is the investment in the first 5 years of life at the prenatal and early childhood stage. And in also at early childhood, education and care is also critical at this stage. And in the second stage, let's look at it as education and youth, where there needs to be an access to education to focus on providing equitable access to education at all levels from early childhood through higher education. And the third stage, which I lump it together as family and parenting, where we need to also consider parental leave to support families during early years of the child's life, and also to have family support services which is accessible and affordable to include healthcare, counseling, childcare, and help parents to balance work and family life. In the fourth stage, which is as we enter through life, we go through the employment and adulthood part of it, where we need to have labor market policies. We should implement that support job creation, fair labor practices, and employment opportunities for all ages. And we also need to look at creating safety net programs and policies to protect individuals and family during periods of unemployment or even economic hardship. And this aspect is critical because right now we have a lot of gig economy and things like that, which are not really being considered in the present social protection program. So we need to look at how we can seize the gig economy, which is happening a lot in our region, to have some social protection programs for them in later life, and also for carers, yeah, because many of us depend on family carers or informal carers for care of older person, and many of these carers are what you call maybe sacrifice their work life to care for the older person because they have no alternatives. So what happened to these carers that resign from work, let's say, and then when they become old, what are the resources or what social protection do they get if they become old and things like that? Okay, so the fifth part will be the middle age and the mid-career people. We need to look at the work-life balance to promote policies that enable work-life balance to happen, flexible work arrangement, and support caregiving opportunities. And in many families, a lot of us are facing the sandwich generation. So we need to look at the family policies that will help us to cater for both the needs of our children and also taking care of the older person, and the issue of training and retraining of workers at these areas in this phase so that we can offer opportunities for ongoing education and skill development to help individuals adapt to changing job market, and lifelong learning opportunities must be available so that they can transition into another job, another career after they retire. And lastly, in terms of retirement and older adults, the pension system, as I mentioned earlier, we don't really have a very solid pension system except for a few countries in the Asia Pacific region. That we need to ensure the sustainability and adequacy of the pension system to support retirees, and also to look at the needs of the healthcare of older people in this phase of life. We need to invest healthcare that addresses specific needs of older people, preventive care, chronic disease management, and also hospice and palliative care. We have to make sure that it's available and provide compassionate assistance in daily life activities. Another aspect that we seldom touch is about housing. We need to create age-friendly housing policies to allow older adults to age in place or other housing options so that older adults have a choice of residence in later life.
It's really in terms of the core of it is security, isn't it? You know, the sense of security for people, as you know, in all stages of life, to feel secure that they have their, you know, that support system that they need to start a family or to grow their family and then to age gracefully. And a lot of countries are struggling a bit, I mean, in terms of finding the right kind of pace, the right kind of set of policies that fit them. And a good example, as you just mentioned, is Japan in terms of how they have evolved their policies to try and parallel it with the ongoing situation with trends that are quite dynamic, changing all the time. But at the end of the day, it serves the country to do it, to do the work, to try and support it, because, you know, if you talk about the concept of demographic dividend, which countries go through before transitioning to aging societies, it's quite significant. Dr. Irvin-Taro, can you explain what, you know, this concept of demographic dividend means and what countries can do to make the most of them? And how is this concept relevant to countries as they prepare to have, you know, an older generation?
Yeah, thank you very much for asking that. I think if we've been focused on life cycle approach from the individual perspective, we listened to the beautiful story of the lady, and I think we looked at individuals, how that, you know, the early stages are very important. And as actually Professor Iden mentioned, how the governments should and also are supporting each sort of the early stages of life as a person, when actually sort of the person wants to have a sort of the kind of the happy and healthy age. But I think the discussion or conversations around demographic dividends, I think that's more sort of looking at as a society level, population level, group of people. So demographic dividend means that, you know, when society is aging, and many governments are worried about, you know, the proportion of the working age among the old population I mean, that means that I think vice versa, how that working age people are actually supporting people who need a care, including older persons, children, people with a disability, how they actually whole society can support them. We listen to lots of policy example from Professor Eisen. Then immediately, what government worried about is, do we have money to support it? Is that enough? And particularly looking at Japan, the most aging country in the world, then means that we actually have a shrinking working age population, whether it's going to be sustainable. The conversations around sort of the life cycle approach from the population perspective are actually sort of talks about demographic dividend, how we can maximize this actually different proportion. There are lots of tips actually around it. As Professor Eisen mentioned, when we actually think about older persons, let's say 60 years old person, 20 years ago and 60 years old these days, they're completely different. They're much healthier, they're willing to work and can actually contribute to the society more. So we actually need to change our mindset. The older person need a care, they can contribute to the society economically, societally, or they have a roles as well. And also, many countries in our region, we have a sort of the gender issues, including my country, Japan. Many women willing to work but cannot because of the gender issues in the society. So how we can maximize the democratic dividend is actually, how we can actually promote the older person who want to work to be working or contribute to society. What we can do to actually sort of promote women who want to work can work. So we call it actually sort of gender dividends and also the silver dividends. Then, the whole society can sustain because we can have more working people. And so we actually talk about sort of the aging as a problem, but it's not. If we can actually maximize democratic dividend conversations and we have a right policy in place to support them, these democratic dividends, and we don't need to worry about. So to enable us not to so worried about the future in terms of economic sustainability of the society, we really need to think about we need to change our mindset. We need to have a right policy in place to maximize the democratic dividend.
Well said. And I think that, ultimately at the end of the day, as you just mentioned there, that it's just not, and we've been talking about it throughout this conversation of ours, that there's no one, key solution for each country. And it's quite insightful, Dr. Rintaro, about your example of your home country. But as to what Dr. Rintaro said, it's multifaceted in terms of the mindset of our society, the mindset of our community, and we have to think about everyone as a stakeholder. So, Dr. Eisen, when we look at that in that aspect, in terms of the private sector, for example, what can be done more from everyone to ensure that, as a community, as a country, we have a healthier and meaningful life for everyone as they age?
I want to look at it from the longevity agenda, because I think that will be a more positive way of looking at aging. Because when you talk about aging, it sounds negative. But if you look at longer lives, then that means you have things to do to prepare for your longer life. How do you fill up those longer life that you have? So I think from the individual level perspective, longer life means you have survived the challenges and you have reached you are blessed actually to live in longer life, and therefore we need to plan on how we should take advantage of our longevity. We are living longer and healthier, as Dr. Rintaro mentioned, and what you need to imagine what kind of life that we can choose, but also in our perspective of the country, we have, as we said, gender issues, and we also have cultural issues, because we have social norms related to the concept of age. At certain age you should behave like this, at certain age you should behave like that. So, but all these norms probably in the longevity agenda may not be relevant anymore, because you have to recreate what you want, what life you want to have in terms of your own life patterns. So in that sense, then you need to look at the norms that we will develop in the future, but also the norm that we design will also means that there must be opportunities for us to have the new age or the new look at old age, because we have a new perspective, a more positive perspective of old age. Because if individually you are negative about your old age, then nothing matters. But in longevity, where you have longer life and healthier life, you need to create meanings in your life. So you need to look at what opportunities is available and things like that in the community and surrounding you, and what defines you as an older person. So that becomes a very individualistic way of looking at how to fulfill the meaningful life in old age. And if you look at the societal level, in terms of looking at the longevity dividend, you really need to look at how do we support older workers, okay, in terms of re-employment opportunities and things like that. For example, like in Japan, as we always look towards Japan in terms of aging, in terms of re-employment policies, and also the definition and opportunities available in there. In Singapore, I think there is a re-employment opportunities policies, but in other countries in our region, I don't think we have that re-employment policies for older person, because there is the misconception of the older person will take over the positions of the younger workers, and the literature doesn't show that to happen. So this myth about the older person taking over the opportunities or work of the younger person might not be true. Yeah. So, but also another aspect of it is to look at the ageism surrounding aging. For example, the corporate bodies will not take older person and things like that, and because it's costly and all those things. So we need to look at the whole spectrum of society, looking at aging itself, because the aging doesn't mean anything because it's just years. But if the institutions are looking at it from the negative perspective, then a lot of things cannot happen. So we need to change to look at aging as a positive psychology, as a positive resource in the future, because all of us in the world will be having an aging population. Okay, so how do we make best use of the resources that we have so that we can promote the meaningful and active aging for the older person? So in terms of looking at flexible work arrangement and things like that, because if you look at the COVID situation that occurs 2 years ago, the country's really transformed and use technology and things like that. But after the COVID recovery stage, we're going back to the old styles of life. So I think we need to look at it again as an opportunity and use technology in terms of this. And many of us in our country is so used to face-to-face work, you know. If you don't come to office, that means you're not working. So things like that needs to change. And then we also need to look at the use of technology in helping to support older workers, because many of we are in a knowledge-based economy. We don't need physical energy except for certain services, and these are opportunities for us to use. And also we need to also support, look at being productive in the employment, and opportunities of lifelong learning and relearn new skills so that we can adjust to the new and future needs of work. And also when you talk about that, we also need to consider about the health factor, because health, a lot of it now becomes non-communicable disease, but we need to adopt more preventive health perspective. And it may not be costly, because if you do a lot of community activities, physical exercise in the community and things like that, it really helps. So we have seen examples that, for example, in Vietnam and also in Indonesia and in Japan, where communities are involved in preventive health activities, physical activities, and looking at them, improves their health status and things like that. So I think that we need to sort of stop the negative look at aging and look at the positive aspect of it, and looking at how can we take advantage of the longevity dividend that all countries will be facing. Thank you.
I'd like to thank both of you for being with us, for this very honest and straightforward conversation about aging. And also, not only that, but, giving us hope in terms of the opportunities, the potential in growth for every country if we just address the situation appropriately and being very positive in terms of, the golden years to come. Thank you so much for being with us here today. This has been the latest episode of Hold On a Minute by UNFPA Asia Pacific. We hope you have gained an insight into how investing in every stage of a woman's life is crucial in countering the increasing aging population in the Asia Pacific region. For more insightful episodes of Hold On a Minute by UNFPA Asia Pacific, follow our podcast pages on Spotify, Facebook, YouTube, and Apple Podcasts. Just search for UNFPA Hold On a Minute. See you in our next episode.